webinar on resources to support local tobacco control. My name's Hazel Cheeseman. I'm Director of Policy at ASH, and I'm going to chair this morning's webinar. So first of all, the technical stuff. So if you experience any technical problems during the webinar, you can use the chat function on the panel on the right-hand side of your screen to let us know, and either Anna or Vicky will try and help you with the problem. We're going to hear from our panelists, and then there'll be a discussion session at the end where you can ask questions. So we're really keen to hear your questions. Put them in as you go. You can find the question, the place to ask questions on the same panel on the right-hand side, and there should be a question bar, and you should be able to type in. Only we'll be able to see those questions, not the other participants. And at the end of the speaker sessions, I will put a selection of those questions to the speakers. We may not get a chance to answer all the questions, and if we don't, then we'll answer them separately after the webinar. I'm also really keen to hear from you on a couple of other things. Anything that occurs to you as we're going through the webinar, a burning topic that you think it would be really great to have a briefing on, or a template that would help make your life easier, or information that we don't have that you would like to see so you could brief a counsellor or whoever it might be. We really want to hear your ideas about, what resources might be useful in the future. And the other thing I'd really like to hear from people as we go through is any examples of how you've used the resources that we're presenting today, where we'll be really interested to hear about kind of innovative ways of using these materials. So, to get started, I will introduce our first speaker. Vicky Salt is Senior Policy and Campaigns Officer at ASH, and she's going to be taking you through some of the local resources that we have on the ASH and the SmokeFree Action Coalition website, and I will introduce our next speakers as we go.
Hi everyone. So hopefully you can now all see my slides. Let's just start the presentation. Where's that gone? So I'm just going to give you a quick run through of the ASH local resources, and then, as Hazel has said, it would be great if people can give us feedback on how you've used the resources, if there are any gaps in our resources, and any questions about what they might be useful for and things. So to start, the main section of the ASH website that hopefully will be of use to you is the local resources page, and I've just highlighted at the top there where on the ASH website you can find that. I'm just going to run through some of the top sort of most used resources from the toolkit. So the first one of those is the Ready Reckoner. Hopefully many of you will be familiar with this, but the Reckoner is a tool. It's an Excel document, both online and which you can download, and that breaks down the costs of smoking to your local area. So you can break it down to your region, to your local authority, and to the wards within your local authority. So you can get right down into finding out which wards have higher prevalence, higher costs of smoking, which wards lower costs of smoking, and it breaks them down to things like smoking-related fires, the costs to social care, the costs to the local NHS. So you can get quite a lot of detail there on the cost of smoking to your local area. The next resource I just wanted to highlight is our local councillor briefings. They are sort of 15 briefings for elected members, so they're just 2 sides of A4, really short, to the point, and they're kind of a 101 to smoking-related issues. So again, we have smoking-related fires, smoking-related litter, making the case for tobacco control, illicit tobacco, that's all in there. So do check out the councillor briefings, especially if you've got new portfolio holders for public health or new councillors elected in May. The other thing that is useful for councillors and for making the case is our local opinion briefings. So every year ASH runs a YouGov survey asking questions about the public's opinion of different tobacco control measures and also new measures that we might want to introduce in the future. And we have regional breakdowns in that data, so you can find out smoking and the public opinion about smoking in the northeast or in the southwest. And again, that's useful for making the case to your elected members that actually there's overwhelming public support for tobacco control. I'm going to skip over social care for the moment because we can come back to that in a second, and just highlight the webinars section of the local toolkit. As Hazel has mentioned, all of our webinars are recorded, and they all go up, the recordings, online after the webinar, so you can share those recordings with colleagues who haven't been able to join, or with other colleagues in sort of partner organisations if you think this is particularly relevant to them. The Article 5.3 toolkit, again, I'm just going to touch on for a second. That hopefully is useful to both local authority tobacco control leads and also for trading standards colleagues. And that has a lot of template resources and briefing material and slide sets on how to deal with approaches from the tobacco industry. So we know the industry has been getting in touch with local authorities recently, and this should really support you in saying, no, we don't want to engage, we're not going to work with the industry, and explaining to elected members and to colleagues why it is so important that we take that stance. And as I said, there's template resources in there if you need to respond, or if you need to publish correspondence from kind of approaches from the industry. So this is our social care tool. As I say, it's under the local resources section. So when you go onto the ASH website, hit local resources, and then if you scroll down, you'll see costs of smoking to social care. Now we know social care is a really big issue for councils at the moment, and particularly with regard to costs. As well as the national report, which sets out kind of the impact that smoking has, the fact that smokers need care earlier than non-smokers, and the costs impact of that. This tool also breaks down those costs to local authorities. So again, similar to the Ready Reckoner, you can look at your area and say, well, actually, in my authority, smoking-related social care needs puts an additional strain on our council, and it costs this much. So again, useful for making the case to elected members if they're thinking about costs or the financial implications of tobacco. So just to expand a bit from the local toolkit, the ASH website has a whole host of resources that should be useful to you in your local tobacco control work. So just to highlight a few of those, we have the ASH fact sheets, and they cover a whole range of issues from specific diseases, so smoking and diabetes, smoking and heart disease, which might be useful for NHS colleagues, and also things such as new regulation, the effectiveness or the implementation of the Tobacco Products Directive, for example. So breakdowns in what different laws mean and what regulations are currently in place. Likewise, our briefings and reports. You may have seen over the last week or so, the Smoking and Pregnancy Challenge Group published a new report on what more we need to do to achieve the government's ambitions around smoking and pregnancy, and that can all be found under the reports section of the ASH website as well. So hopefully there should be lots more resources there that can support you in your role locally. And also if you have new colleagues, we know there's a lot of change in local authorities at the moment. Hopefully this would be a sort of really useful tool for getting new colleagues up to speed on tobacco control issues. Also just to mention is the law guide. It would be great to get your feedback on whether you have used this, how useful you found it if you have, but that's a breakdown of all tobacco control legislation, so the laws that govern our sort of tobacco regulations, so everything from smoke-free legislation to standardised packaging is all in there, and so it'd be great to get your feedback on how useful that is. hopefully many of you will be familiar with these images. The local government declaration on tobacco control is a declaration that was published after the Health and Social Care Act moved the mandated responsibilities for public health into local authorities. And what that sets out is top level, signed by the Chief Executive of your council, the Chair of the Health and Wellbeing Board, and it really shows a high level commitment to reducing inequalities from tobacco, to tackling tobacco and smoking rates as the greatest cause of preventable and premature death. And it sets out what actions councils can take. So again, it includes not working with the tobacco industry, it includes developing local action plans tailored to the needs of your local populations and what you're going to do to support people in your area to quit. And at the bottom there, you can just see where it's found on the SmokeFree Action Coalition website. So slightly different from the ASH website this time, but if you go on SmokeFree Action, it's under SmokeFree Local Government there. And as well as the declaration itself, there's briefings, there's an FAQ document to support you in getting to grips with the declaration. And if anyone hasn't signed that, we would certainly encourage all councils to do so. Moving slightly from local authority to local NHS, we also published in January this year the NHS SmokeFree Pledge, which is an update to the NHS Statement of Support for Tobacco Control. That's very similar to the local government declaration, but for NHS colleagues. And that sets out what the NHS can and should be doing to support reductions in smoking prevalence. So really important commitments around treating tobacco dependency, ensuring smokers within the NHS have access to the medication they need to quit, and really delivering on the NICE guidance around smoking in the NHS. That pledge is, as I say, relatively new, published in January, and we know there are a lot of NHS organisations out there yet to sign. Anyone on the webinar who's thinking of signing, if you've got any questions, do get in touch. And for local authority colleagues, do encourage your NHS trusts and CCGs to sign the pledge. And not just to sign, but then to act on the commitments. And hopefully the pledge will be a useful tool for you in talking to your NHS colleagues and saying, well, you've signed the pledge, what are you doing to ensure smokers have access to medication? What are we doing to ensure that we're creating environments that support quitting? So hopefully those tools are useful for you as a communications exercise, and then also in corresponding and making sure the commitments are being delivered on. Just building on some of our other NHS-oriented resources, the SmokeFree Action Coalition website has a whole host of things for NHS colleagues and for local authorities supporting the development of support for smokers in the NHS. So this is the resources of the Smoking in Pregnancy Challenge Group. Again, it's under SmokeFree NHS. You can access all the resources in there. And the Challenge Group has created some amazing resources for healthcare professionals and for pregnant women to encourage asking about smoking status, to encourage giving very brief advice and support to pregnant women who are smoking or even who are living with smokers and being exposed to secondhand smoke. So the really key things there, you can see the screening, carbon monoxide screening advice for healthcare professionals, the Test Your Breath, which is a little information card for pregnant women, and as you'll see, that's now available in several other languages as well. And I think the most popular of these resources, the use of electronic cigarettes in pregnancy and the guide for healthcare professionals. Hopefully these resources are all really useful to you, and if you've got NHS colleagues who aren't on the webinar who haven't maybe seen these resources, do point them in this direction. The Smoking Pregnancy Challenge Group also links to other web pages and other resources, including NCSCT resources that are helpful in training and supporting colleagues around smoking in pregnancy. So moving from pregnancy to one of our other really high prevalence groups, as you'll all know, smoking among people with mental health conditions is much, much higher than the general population. And ASH also coordinates the Mental Health and Smoking Partnership, which was established in 2016 and is bringing together local authorities, local NHS trusts, national public health organisations and national mental health organisations to address what more we can be doing to deliver a decline in smoking rates among people with a mental health condition. Some of you may have joined the partnership webinars that took place last year, and they're accessible on this webpage. And there's also resources for NHS trusts and trust boards. We wrote to all NHS trusts in January this year, highlighting these resources and enclosing copies for chief executives. But for anyone, smoke-free leads, anyone with an interest in what their board is doing around reducing smoking rates among their clientele. You can see here there's a question and answer for trust boards around what they're doing to implement NICE guidance. There's a shared key messages, which is kind of the key headlines for smoking and mental health and the evidence base around what more we need to be doing to really encourage the decline there. There's also a statement on e-cigarettes. So the partnership came together to produce a statement on electronic cigarettes and their use among people with a mental health condition. So again, hopefully really useful evidence there for local trusts and CCGs thinking about how to approach e-cigarettes. Again, the partnership's webpage also links to other web pages where there are useful resources. So again, the NCSCT, but also a really useful resource published just at the end of last month from the National Fire Chiefs Council on the charging of electronic cigarettes in inpatient services. That could also be useful for acute trusts as well. But hopefully lots of materials there to support you in delivering support across a range of high prevalence groups as well as to your general population of smokers. And I'm going to say, I think I'm going to hand over now. It would be really useful to get your feedback on what ASH resources you've used in the past, what you're currently using. If there are things where you think actually it'd be really useful to have a bit more support around this issue, then let us know, and hopefully you'll be able to ask Hazel lots of questions towards the end.
Thanks, Vicky. I don't think they're going to be asking me questions. I think they're going to be asking you questions. So definitely get your questions in. But also, as Vicky says, we're really interested to hear your feedback and your ideas for things that need to be developed in the future. Okay, we will move on now to our response from PHE. We have Allan Gregory and Martyn Willmore from the Tobacco Control team at Public Health England. We're going to hear from Martyn first of all. Martyn is going to give us an overview of the Clear Tobacco Control Assessment and the new deep dives, which are well worth a look at if you haven't had a chance yet. And then Allan is going to talk us through other PHE resources and what support is available for translating policy into practice. So I shall hand over to you, Martyn, now.
Thanks, Hazel. Good morning, everybody. And hopefully you can both hear me and see my slides on the screen as well. As Hazel says, my name's Martyn. I work for Public Health England as part of the National Tobacco Control team. And Allan, my colleague, and myself will have 20 minutes or so talking about some of the tools that are available from Public Health England. And I'll spend about half of that time looking specifically at this product called Clear. I'm very conscious that some colleagues on the line will probably be very familiar with Clear and have used it in the past, but others may be less so. So I'll talk a little bit about the background to Clear and what it is. And then towards the end, I will talk, as Hazel mentioned, about some of the recent updates and the exciting new offer that's available around Clear as well. So hopefully that will be new news to a lot of colleagues too. So as a background to Clear, the technical bit is that it's a system-led improvement tool for tobacco control. It was originally developed by colleagues in ASH a few years ago now, but is now managed by Public Health England. And essentially, Clear is a tool which enables local systems to score themselves against established standards of good practice. Typically, those standards will be drawn from NICE guidance where it exists and where it doesn't exist for areas of tobacco control, for instance, around tackling illegal tobacco. We will draw upon evidence from best practice nationally or internationally. So the process helps localities to identify areas of strength and weakness in their tobacco control activity and can help form the basis for local improvement planning. It's recently undergone quite a few revisions to make it both easier to use and hopefully quicker to use as well, and I'll talk a little bit about that towards the end. And because I'll forget to mention it later on, also just to flag up now that colleagues in alcohol harm are developing a similar tool around alcohol, which will be available over the next few months. In terms of what CLEAR stands for, it's an amalgamation of three terms really. So the C stands for challenging services, looking at local innovation and learning and how we evaluate what we do. The LEA stands for leadership, so local vision, planning and commissioning, and engaging with partnerships. And the R stands for local outcomes and whether we're achieving some of the local priorities that have been identified. So that's where the terminology CLEAR comes from. I'm going to talk a great deal about the technicalities of CLEAR, but in essence it boils down to two main elements. One is a self-assessment process that can be undertaken by a locality and is done entirely within that locality. And the second optional element is an external peer review, and I'll talk a little bit more about both of those and what they entail over the next two slides. I already mentioned that CLEAR draws upon a lot from the latest tobacco control plan for England and NICE guidance, and is designed, certainly initially designed for use by local authorities and broader tobacco control partners. But as part of the recent updates, we've tried to make CLEAR as relevant as we possibly can to a new audience within the NHS. And again, I'll describe how we've done that a little bit later on. CLEAR is essentially a diagnostic tool, and it helps to signpost other helpful resources, some of which Vicky's already covered as part of the ASH update. Whenever Allan and I go around presenting CLEAR or supporting CLEAR nationally, we're always at pains to point out that it's not an audit or an inspection. This isn't PHE or anybody else coming in to tell you what to do or to provide you necessarily with scores. It's very much a tool for you to use locally and to help drive that local improvement. So I've mentioned it comes in two main parts, the first of which is a self-assessment. And the first thing to mention about the self-assessment, most importantly, is that it's entirely free to do. Tools to support you to do that are all online on the link there. And essentially that would be a user guide for how to conduct CLEAR and the CLEAR self-assessment tool itself. So the self-assessment tool will pose a series of questions to the locality about a breadth of topics to do with tobacco control, and will invite that locality to score themselves as either having strong evidence of compliance or some evidence or no evidence of achievement. And so working through that process will generate local scores. And these scores will then add up and will highlight areas of strength locally, as well as potential areas for improvement too. There are relatively few hard and fast rules for how we'd expect CLEAR to be undertaken locally, but one of them is that we would hope that it would be a collaborative process and not completed by just one person. There are really two main reasons for that. Given that this is about assessing the whole breadth of activity around tobacco control, it's relatively unlikely that one person will have that full breadth of knowledge and you'd just be getting one person's perspective. But I'd say the main reason is that a lot of the value from the CLEAR process comes around from getting partners together around the table and taking a little bit of time out of their day-to-day to discuss tobacco control, and also to hear how their bit of tobacco control activity fits in the broader picture. The self-assessment results, once they're generated, are solely for the use of locality. They don't need to be shared with anybody. You can share them with PHE if you so wish, but there's no obligation to do so. So having said that the self-assessment is all entirely driven locally, there is an offer from PHE nationally and from the centre leads to provide enhanced support for localities. So if any of you are interested in undertaking CLEAR self-assessment, but maybe aren't quite sure what that entails, you can certainly invite Public Health England to come down for maybe half a day and to work through a process and a workshop to support localities to do that. So that's self-assessment. The next stage, which is entirely optional, is the peer assessment. So this is administered by Public Health England, linking with experts in the field and the local tobacco control lead. Again, the important thing to flag up about this is there is a cost associated with this part of the process, but I will deal with the costs at the very end. Typically, the peer assessment will involve a one-day on-site visit by a relatively small peer assessment team who will come to the locality and will either run a half-day workshop where we get all relevant tobacco control partners together to talk about issues as part of the CLEAR process, or it might be individual or group interview format. In preparation for the peer assessment, we would expect the locality to submit their evidence to support their self-assessment score. So why did you assess yourself as being strong in certain areas, and the evidence to support that? And as part of what the peer review team would do, they would look at that evidence in advance of the assessment visits, and that would help them to identify key lines of inquiry for the day. A peer review team would typically consist of, would always consist of one lead core assessor, and that would be an individual with substantial experience of tobacco control, substantial training around clear, and a strong reputation in tobacco. And they will be the main contact for the locality throughout the process of the clear peer assessment. The lead or core assessor would be supported typically by around 2 to 3 peer assessors. These would generally be local tobacco control leads, people that have gone through the clear process themselves, either doing a self-assessment or ideally having been on the receiving end of a peer assessment themselves. And they would have also undertaken some training to support their peer assessor role. And again, typically, we might have 1 or 2 other representatives on the team. So usually there might be somebody from PHE, whether that be somebody as part of the Public Health England national team or centre team. And I also know that colleagues from ASH and other organisations are always keen to be part of clear peer assessments, because it helps us engage with localities and understand better what's happening on the ground. As part of the peer assessment process, there'll be initial feedback provided to key partners at the end of the day, and that will be relatively brief and high level, but a full report will be shared within 3 weeks. And once again, this is for local use only. PHE will share the report with the lead person locally, and then it's down to them to disseminate as they wish. So I mentioned at the very start that Clear has recently undergone some changes, and mainly they were to reflect changes in the public health landscape and priorities. If you imagine that when Clear was first set up, we didn't have things like CCGs or STPs, so we just needed to update the language and also to reflect all partners involved in broader public health. There was also demand from localities to make the process somewhat shorter. So we've reduced the number of questions within the Clear tools from around about 130 down to about half of that number now, so it's slightly quicker to do. I think probably the most visible change that we've made, and Hazel alluded to this, is the introduction of these things called Clear Deep Dives. So usually in the past, what we've had is one generic Clear tool that covered the whole breadth of tobacco control. What localities told us was that was still useful, but they knew or had identified some areas where they wanted a particular focus. And typically those would be things to do with smoking in pregnancy or smoking in the NHS. So we've developed some deep dive tools that look and feel like the original Clear model, but are just much more focused on specific topics. So those 3 deep dives that are currently available cover smoking and acute settings, smoking in mental health settings, and smoking in pregnancy. And there's a 4th deep dive, which is being finalised as we speak, around tackling illegal tobacco. So I already know that a number of localities have been using the NHS-focused deep dives. I think it's quite timely that they're out there, so they can certainly help to localities get some assurance around their compliance with NICE guidance, very timely around helping localities to achieve sequin, and more generally making progress towards smoke-free NHS. So if a locality can undertake any of these deep dives, either led by the NHS in conjunction with the local authority or vice versa, then they can have some degree of confidence that they're making progress towards the smoke-free NHS agenda. Probably important to flag up at this point, spoken about the self-assessment and peer assessment. The deep dives, their concept is only at the moment around a self-assessment. There's no idea of an external team coming in to peer assess the deep dives. So the last slide for me, I mentioned at the start about the cost involved in peer assessments. I just wanted to take you through the latest situation with that. So typically peer assessments cost £2,500, and that covered the cost of the assessment team, preparation and finalising the written report. PHE's recently secured some funding for the next 2 years to subsidise that cost, and that's now going to come into localities at £1,000 per visit. In order to help us facilitate that contract, we've appointed Improving Performance in Practice, or IPIP, to lead on the assessment visits over the next 2 years. And IPIP will draw upon established core assessors to help them deliver that, and they will pull together peer assessment teams, as was always the case. In order to supplement that, we are planning, PHE and IPIP are planning some training shortly and later in the year to train up new peer assessors, but also to give some refresher training to anybody that's maybe undergone that training a few years ago and would like that refresher. So the final plea for me, if any localities are interested in finding out more about either having a peer assessment or becoming a peer assessor, or even want support with undertaking a self-assessment around CLEAR, then please just drop us a line. I'm going to put CLEAR email details on there, and I will leave it there and happy to take any questions at the end. Thank you.
Allan, we're over to you now. Allan is going to talk to us about the other resources which PHE have, hopefully. Allan, I think you might need to unmute yourself. There we go.
Hello, thank you very much. Thank you. Hello, everybody. Apologies, I found myself muted by the organiser and myself there. Thank you, Martyn. And hello, everybody. I'm going to talk to you a bit more about a range of other tools and resources from PHE and point you to maybe some others as well about delivering tobacco control locally. It's worth noting that as we go through this, that what I will do is make some reference to the tobacco control plan that was published last year, and also about the tobacco control delivery plan that was published just over a month ago now as well. So the delivery plan sets out a number of milestone actions that I would like to see from national partners, but in particular also suggests some activities you would like to see from local partners as well. So with that in mind, the tools that PHE has produced over the years, as they get refreshed, and as they have done in the last year, they will take on board any particular asks and calls and direction from the tobacco control plan as well. And as part of the delivery plan, some of the actions from PHE have been to produce a number of resources and tools, and some of these we'll cover today as well. So in looking at the tools, it's very much a case of, we've always presented the tools in the past as a sort of a toolbox approach. You take them and use them as you see fit. But what we like to be able to do as well is, just referencing the slides from Martyn about CLEAR, is maybe suggest sort of how you can target the use of some of these tools. So as we go through these tools, we'll sort of present them through, let's say, a CLEAR lens about how we can actually achieve some of the objectives behind CLEAR. So the first one around leadership. So obviously, under leadership in CLEAR, we want to demonstrate some clear vision locally. And so there's a link there to the CLEAR resources, as Martyn's just demonstrated. But I'd like to focus a bit more under that demonstrating leadership element around looking at some planning and commissioning tools, in particular our commissioning support packs that were previously called JSNA support packs. And also in terms of developing partnerships locally, especially with STPs and integrated care services as well. I have a very brief look at what's in the menu of preventive interventions. Apologies. Let's go back to that. Okay, so our commissioning support packs, first of all. The commissioning support packs are really based in NICE evidence. So it's bringing a lot of NICE evidence and making sense of it for commissioners. So it looks at a set of good practice principles and indicators, and it's aimed at helping local areas assess need and plan and commission effective services and interventions. There's about 10 chapters there. So it very much looks at the good practice principles around commissioning for comprehensive local tobacco control. It will obviously take on board good practice evidence around supporting people to stop smoking, looking particularly at pregnant smokers, smoke-free homes and cars, preventing young people from taking up smoking, primary care, secondary care, a whole list there. And so this compendium type structure, we've had some very good feedback in the past, and we would welcome anybody feeding back on any new areas that need to be in there. This pack is updated every September, October each year. And the commissioning prompts is also supplemented with a data sources pack. So for each local authority area, what the data pack tries to do is bring lots of data, particular to that your local authority, into sort of one compendium. And it also then acts a bit more of a signposting to the actual tools themselves, some of which Vicky has already presented from the for the Ash Ready Reckoner, for example, and some of the other tools is what I will go into more detail on in a moment. But the commissioning support packs, as I say, comes out every year, every September, October. But what we'd like to do this year as well is that there will be a sort of a wider consultation process about how they're being used and whether they're fit for purpose and how they could be developed going forward. And it's also worth noting that the commissioning support packs are also supplemented. Not only was this pack for tobacco control, but there's also other packs for alcohol and drug services as well. I mentioned the menu of preventative interventions. Now, this was something that was put together in 2016 and has been updated a few months ago as well now. And this was to PHE's attempt to support the development of STPs and local planning at the STP level, to look at a range of public health interventions, and in particular promote those that had a very good evidence base. So in this menu of preventive interventions product, you'll find actually there are 4 areas that deal with tobacco. It's worth looking through them because it very much focuses on smoking in the NHS in particular, about offering very brief advice and cessation in hospital services. But what is very useful in terms of making cases locally is that for each public health domain that it tackles, it compiles, it says what is the evidence in terms of its cost effectiveness, the actual cost locally and the net savings, and also sort of highlights who can take some action and looks at some progress indicators as well. And the progress indicators is really interesting, especially if some of those indicators, your indicators locally have some red flags against them, whether it be a higher smoking prevalence than normal. And again, going back to one of the key tenets of the tobacco control plan, where there's a challenge to local areas to identify their local populations of need, there's real opportunity there to focus in on the menu preventive interventions and say where is most cost-effective actions that could be undertaken locally. So it's worth having a look at this one. It will be, we think it's going to be updated again every few months, but it's something that is worth definitely sharing with your wider SDP partners across your local systems. The other parts of the clear domain around challenging services, there are sort of 3 main areas we sort of look at here in terms of one the principal issue of local stop smoking services, about how do we support people locally to quit. A new focus on NHS services now around SmokeFree NHS, and in particular the CQuin that's come on board, and also again identifying some priority groups. So we do have some resources here. I won't go into detail on the ones on pregnancy and mental health, because principally we have the clear deep dives that Martyn mentioned previously, but also the resources from the Smoking Pregnancy Challenge Group and the Mental Health and Smoking Partnership Groups that Vicky mentioned previously as well. But if we look at the stop smoking services, one thing that PHE did is they produced a paper that looks at the models of delivery of stop smoking services up and down the country. So this is to support directors of public health and local healthcare commissioners to appraise the evidence and to enable informed decisions on the provision of local stop smoking support. So this maps out the experience over the last year or two of the changing offer from local authorities in terms of supporting smokers to quit locally, and actually lays out the evidence base behind that about how effective they are, how effective each type of intervention is. So this is a very good reference tool for any commissioner that's looking at their current stop smoking service offer, and if they're looking to make any changes towards that, this is an excellent tool, and it also offers offers people the opportunity to offer local scrutiny on decision making and proposals going forward. Moving on to SmokeFree NHS, there's an abundance of resources now around developing a smoke-free NHS. It's got a very high profile in the tobacco control plan, and there are a very high profile now in the 5-year full review, and more recently announcements from NHS England to actually undertake more of a commitment to providing cessation support to their patients who smoke. With that in mind, it's probably worth just sort of pausing and just make sure we understand the definition of smoke-free NHS. When we talk about smoke-free NHS, we're not talking about the environmental concern of no smoking on a given site. We define smoke-free NHS threefold of every frontline healthcare professional discussing smoking with their patients. That conversation takes place. And within that conversation, all smokers are offered some form of stop smoking support, either on-site through pharmacotherapy and behavioural support on-site, or onward referral to local support services in the community as well. And that is underpinned by a completely smoke-free buildings and grounds policy. So the focus on smoke-free buildings and grounds is so that we get compliance with the treatment programs going on in the hospital walls. So it's one of the key resources here to look at would be our Health Matters blogs at PHE. So the Health Matters blogs, again from PHE, come from a number of different sources around public health, but particularly the ones on smoking are, over the last couple of years have been very, very popular. And then there's a whole suite of those now dedicated to smoke-free NHS and about the developments going on there as well. It's worth noting that a new resource is about to come out in the next week or two, and that will be a smoke-free NHS newsletter. And that sort of gives us different updates from NHS England and from PHE and others around the smoke-free NHS agenda, and also points to a number of case studies, and would also support the sequin as well, which I'll come on to in a moment. We've already mentioned the clear deep dive tools around acute settings, mental health settings, and pregnancy services. They provide a very good opportunity for NHS trusts to take a very quick but comprehensive assessment of where they are in delivering nice guidance locally. I mentioned the sequin resources, so you'll be aware that we've got a national sequin quality indicator around identifying smokers who are inpatients, identifying inpatients who are smokers rather, and making sure that they're given some brief advice and then provided some support to quit by being referred to stop smoking services or other quit offers in the community. There's a whole suite of resources on that sequin now, including training modules, including case studies, and there's an opportunity there. There are some forums there as well for people to share learning and work together if people identify problems in local implementation of the sequin. So the sequin resources link there gives a whole suite of resources available. And it's probably also worth just noting, as we're on smoke-free NHS, the new RCP report that was published a week or so ago now as well. So the new RCP report, Hiding in Plain Sight, looks at the offer of smoking cessation in hospitals, and there's a suite of recommendations in there about what more NHS sites can do. But in particular, one of the things to bear in mind is that it's sort of updated a lot of the evidence base around tobacco, and in particular mortality and morbidity and the impact of tobacco and the benefits of cessation in hospitals and for our NHS patients. So it becomes a very good reference paper as well. So it's definitely worth having a look at that.
Allan, just giving you a 2-minute warning.
And on to my final slide. So the final part then is results. So one of the things we need to do, the biggest impact here biggest tool that is available here for results, not only mapping where you are now, but also tracking any changes over time from the impact of your local tobacco control activity, is looking at the local tobacco control profiles. So they're there to help all local services. They can help inform your commissioning and planning decisions to tackle tobacco use, and ultimately improve the health of your local community. And the online tool helps you to compare your local authority against other local authorities in the region and against the England average as well. And when you go into the tool, as you see, there's a whole array of indicators you can find, whether it be some smoking prevalence in adults, smoking prevalence in young people, looking at mortality rates and the impact of ill health. But there's also an opportunity as well to look at inequalities, look at your trends, as I say. But there's a section here called Further Information. And Further Information now, it links you to a whole suite of tools and links in more detail. So the local tobacco control profiles are now giving these further resources. So, for example, the smoking and pregnancy resource button there, when you link that, you'll get through links to a lot of the resources around smoking and pregnancy challenge group, for example. And likewise, of all those other areas. This is a growing new platform under local tobacco control profiles. So when this gets updated every month or so, you'll find that it will grow and grow and grow. And finally, just to say as well, if you want to stay up to date on any of the new products that Public Health England produce in particular, or from Department of Health and Social Care as well, you can go to the .gov.uk site, and there's a collection of articles there and products that come through .gov.uk. If they're tagged tobacco or smoking, they all get under this collection. So you can always subscribe to that for updates from there. And as you can see, it will include evidence reviews as they come on board, but also particular information and advice for healthcare professionals, supporting SmokeFree NHS, and also any new updates to tobacco and smoking data and statistics as well. And with that in mind, I'll sign off there with that big reminder for feedback on the tools as you use them. Thank you.
Thank you so much, Allan, and to Martyn as well. So I will move on to our final speaker, who I am delighted to say is doing a terrible job of being retired as the former Stop Smoking Service Manager of Leicester City, and is now working for the National Centre for Smoking Cessation and Training. So Louise is going to talk us through the resources that the NCSCT have, and I'll hand over to Louise now.
Thank you very much, Hazel. And I've really enjoyed the webinar so far. I've learned a lot just from hearing the other speakers, and I hope I can share some useful things too. So, as Hazel said, I used to be the Stop Smoking Service Manager for Leicester City, and I'm now working as a freelance clinical consultant for the National Centre for Smoking Cessation and Training. And I think it's fair to say that there is an enormous amount of resources on the NCSCT website. I'm just going to choose 5 that I think are really valuable to share with colleagues who are listening in and people that are going to see the webinar later. And a lot of people have just looked at it maybe for the training, say, and have only scratched the surface really of what's available. But there really is something for everybody, whether you're a trainer, a practitioner, commissioner, and for healthcare professionals in primary care, maternity services, acute care, in mental health. Even the general public, since I've been fielding questions from people about the NCSCT website, I've picked up quite a few from the general public, who are interested in the whole stop smoking agenda and have gone to NCSCT for information, which I think is great. So some of them I'll go through here. Others, do have a look through the menu. It's a really good site to search. One of the first ones, I think, and one that I'm very proud of, is the information on e-cigarettes. We have a guide for healthcare professionals. This is a collaboration with the New Nicotine Alliance and Public Health England. Now, you'll be familiar with Public Health England, but the New Nicotine Alliance is a charity that doesn't receive any funding from the vaping industry, certainly not from the tobacco industry. It's simply by donation from individuals to inform and educate the public and healthcare organisations about the benefits of looking at vaping. And the briefing on e-cigarettes goes through some really useful information for people who are not sure. And clearly there are a lot of people in healthcare who are not sure. when I was manager of the Leicester service, I sent this guide in electronic form around all the GPs in Leicester and got some really good feedback from healthcare professionals who said that they just don't know what to say when their patients come and said, I've been thinking about vaping, what should I do? So I'd really strongly recommend this briefing. It can be bought in hard copy if you wanted to buy it. You just have to look on the menu on the website for the NCSCT shop, but it can be distributed as an electronic link as well. My next top pick was the very brief advice for healthcare professionals, and we've got a number of VBAs here on the website. One particularly pertinent for GPs and practice nurses in primary care. There are others, one for pregnant women and one on smoke-free homes. And I think this really, really clearly links to the smoke-free NHS agenda, because we often hear from healthcare professionals that they get into a circular debate with patients about their smoking. That, you know, they'll ask about smoking as is expected of them, but then they sometimes ask the wrong questions, which then mire them in a somewhat depressing debate where the patient just argues the point, and the more questions they ask about, well, you know, how many do you smoke a day, you know, how long have you been smoking for, things that don't necessarily move the agenda forward, then, you know, the worse it gets, and then the healthcare professional gets a little bit depressed about this as well. So the very brief advice uses a very effective and proven way of bringing out the right things from that conversation, and it's very simply ask, advise, act. So you don't get waylaid by arguments that in fact waste clinical time. So do have a look at it, and do share with other people who would like to benefit from that. Midwives, very much catered for, and we've heard quite a bit so far about smoking and pregnancy, but there's an excellent toolkit for midwifery staff and others, you know, say in Sure Starts children's centres, who are giving advice to pregnant women who smoke. Dealing with difficult questions. Again, pregnant women are, you know, they have a number of anxieties about, you know, what, you know, should they use patches, can they vape, and so on. And this will address many of the difficult questions that patients may bring forward. One of the newest resources that we have is a guide for mental health practitioners that goes through policies. What does the smoke-free NHS mean? The impact on mental health recovery of stopping smoking. It also talks very much about preparing people for admission to a smoke-free unit. How do you go about that? How do you deal with issues about people smoking or wanting to smoke when they're actually admitted? Because this, as we know, can be a very tense time, both for staff and patients. But also about on discharge, what should happen when somebody goes home? Because it's clearly easier to deal with smoking issues when somebody is in the community, when they have access to a full range of services, and also because they're more stable at that point. So, there are several chapters that go through the patient's journey, and it's absolutely full of good advice, written by Dr. Andy McEwen, who's the director of NCSCT, and Dr. Debbie Robson, who is a practitioner and has a wealth of experience. I've used her many times for advice on situations in mental health units, and what she doesn't know about it isn't worth knowing. She's very, very good. Works at South London and Maudsley. Last but not least, there is a suite of films. All the recent ones are about vaping. If you look on the home page you'll see the YouTube link, and you'll see there's about 16 films, some very short ones, some longer ones, and this one that I'm showing you a screenshot of won an award at the first Global Forum on Nicotine Film Festival this year. It's a joint project with Public Health England and, again, the New Nicotine Alliance. And it's a super resource to share, as are the other films. There's The Switch, there's film on safety, and some very eminent people that you will recognise from their head and shoulders views on the site. As people who really know what they're talking about. So I do encourage you to share those. And finally, sorry, it's not moving forward. There we are. Do look at the NCSCT page on Facebook and Twitter. Ask questions, make comments, and keep this debate alive. We're getting a lot of good interaction with healthcare professionals, with people in local authorities, and the general public. And the more discussion we can keep going, the better informed people will be. Thank you very much.
Thank you, Louise, and thank you to all of our presenters. I am going to start asking them some questions now, ones that you've posed to them. I'm going to give them a chance to think about the first question that I'm going to ask them, and I'm going to pick up a couple of the questions that I can answer from the ones that have come through. So the question that I'd like our four speakers to think about is, if you were doing a briefing either for or providing information to a new lead member or a new member of staff, or perhaps the new chair of your Health and Wellbeing Board, there's three quite different stakeholders. What's the information that you would go to first to provide that briefing? So I'll let you have a think about that while I just answer a couple of the questions which have come through that I can answer specifically. So Paul Hooper from IPIP quite rightly raises that some of the smoking and pregnancy resources are available through IPIP at no charge, and therefore maternity services specifically, so test your breath cards and so forth. If people want more information about that, if they don't know, they should get in touch with me or Vicky, and we can put you in touch with IPIP directly if necessary. There was a very, we might come back and talk a little bit more about information on e-cigarettes, but somebody has asked about whether there is data on e-cigarette prevalence that goes down to sort of local or regional level. As far as I'm aware, that this isn't available. I don't think the sample sizes that we have at a national level are large enough to enable us to do that. If any of the speakers knows different, then do chip in. And also, we've had a request that the slides be circulated after this, after the webinar, which we certainly will do, and then also the audio and the presentations will be available to watch again or to circulate. So I'll come to our speakers then. I'll start with Vicky. Vicky, you can choose one of those stakeholders, councillor, new member of staff, or the chair of your Health and Wellbeing Board. How are you going to brief them?
So I will kick off with a councillor, and I think the advice we would give is that it's really about finding what they're interested in, so what's going to capture their interest with regard to tobacco. So have they previously worked in a role with children or with pregnant women? Is this their first portfolio role on a council? If they're your cabinet member, then were they a cabinet member previously? So it's really about finding out what's going to ignite their interest. And then I would say you can tailor that. So if they have a particular interest in social care, there's the ASH cost of smoking to the social care tool. But across the board, for all councillors, the Ready Reckoner is a great tool, because we can break down the cost of smoking to their specific ward. So in their area, precisely the people they represent, this is the impact of smoking on them.
Great, thanks, Vicky. Martyn, Allan, what do you think? New member of staff, chair of the Health and Wellbeing Board, what would you give them?
It's Martyn here. I was also going to go back to councillors, but I guess it applies to the chair of the Health and Wellbeing Board as well. I think, just briefly on councillors, I think some of the ASH resources around the fact sheets and the briefings are really important, because we can't assume that they will be steeped in tobacco control. And we know we have to kind of fight this misconception that we've already done an awful lot on tobacco, which we clearly have, but that there's no more to do, which there clearly is a lot more to do. So we need to re-emphasise to them the local cost of smoking to them and make it real to them as kind of lower level as we possibly can. But I'd also flag up, as well as the cost and the impact, I think with councillors we also need to reiterate some of the data that's around there about public support for some of the measures that we've taken and some of the public measures that we're discussing, just to reassure them that it's not just the right thing to do, it's also a very popular thing to do. And I think some of that goes for health and wellbeing boards as well. I mean, Allan could speak better than I in terms of engaging with partners from the NHS, but I think it's making the impact for them locally on what this could potentially mean for acute trust in terms of bed days and readmissions data, and really making that as local as we possibly can.
Allan.
Hi, yeah, just follow up that bit around the engaging health and wellbeing boards. I mean, a health and wellbeing board is usually chaired by a local councillor, not always, but in the main. But it's about health and wellbeing board is about the system's priorities and what benefit there is to the system from local tobacco control. So I would answer that threefold. Where are we now? Do we have a really good needs assessment of our local population? And do we understand the real needs of our smokers? Who are our smokers? Which priority groups are they in? Do they have any particular needs in terms of how we can support them to quit? And also, what's the needs of the local system as well in terms of sustainability? Yeah, what role can tobacco control have in providing a sustainable local health system? Where do we want to go? The tobacco control plan gives us some very clear targets to aim for, but that would also come out of our local needs assessment as well. We want to meet those needs of those populations. And how are we going to get there? Well, I think first of all, we don't get there in isolation. We get there together with our partners and as local systems. And the way to get there and develop that action plan and take stock of where we're at is probably via CLEAR. CLEAR gives a very good opportunity for all partners to come together, for all partners to demonstrate how they're contributing to a comprehensive local tobacco control. And out of CLEAR, you can develop a very good action plan about how you're going to get to meet the needs of your local population.
Thanks, Allan. We've had a comment from someone saying that this webinar should be part of the induction for people who are new to tobacco control. Louise, you must have inducted people, I'm guessing, who are new to the field. What did you point them to as their first starting point?
Yes, it's a really fascinating question, and I think, I mean, certainly from a practitioner point of view, I would start with NCSCT resources, because you've got there the best evidence and the most effective ways of opening up conversations. But I think looking at your list of new lead member, chair of the Health and Wellbeing Board as well, I think I would want very early on to draw their attention to the issues in mental health circles about smoking, because they will inevitably come across people in their work where who say, it's really not fair on these people. They've got so little. People are still saying this sort of thing, and to give them the ammunition to come back with a cogent argument about why it is so important to tackle smoking amongst mental health populations, and how beneficial it can be for people who can then reduce their medication, live a much more anxiety-free life, and have more disposable income. There are so many good reasons to support reducing smoking amongst mental health populations.
Thanks, Louise. I suspect, you might have answered one of the other questions that we have in that statement that we've had from somebody who's asking how they can do more to engage with mental health staff specifically, who they're trying to get to engage around smoking cessation. And they're specifically asking about PowerPoint presentations and templates, and certainly there are some that are available on the Mental Health and Smoking Partnership website, and we can circulate some links. But do you have any other sort of hints and tips specifically on that question of engaging frontline mental health staff, or perhaps those who are planning services around mental health?
And the patients as well, and their families. Yeah. I think it can be tackled at a very simple level in a way, and that's asking people and gathering some anecdotal comments from patients. Why do you think we're making the wards smoke-free? And the answer often is, well, just because you hate us all, because you want to make life difficult for us. And when you say, will it be okay for me to explain a little bit to you about why we're doing this, and talk about, the long-term disability, the premature mortality, the extra medication that they have to take because of smoking, and you often then get a sort of, oh, I didn't realise that, and it opens the door for further conversation. I did this in all the wards in Leicestershire and gathered some of that feedback from patients, and it was a really, really valuable tool to share with other people who had initially been, very hostile to the idea of a mental health ward going smoke-free.
Thanks, Louise. Is there anything, Allan or Martyn, you would add, perhaps from the CLEAR model or the other resources?
I can add from CLEAR, because there was, apologies, Martyn, when we first looked at revising and developing CLEAR, one of the first sort of offshoots of that was developing a mini CLEAR for mental health, which then became the forerunner of the deep dives. So there is a lot of a big suite of resources around supporting smoke-free mental health on .gov.uk, and we can share that direct link with you. And within that, it's got a whole template of how to run a workshop day at a local mental health trust, how to engage leaders. It has a lot of video resources as well, particularly around mental health, and it's the sort of thing that we'd like to build upon for the other deep dives as well. Sorry, Martyn.
No, that's a really good answer. All I was going to say is strategically, I mean, Louise is obviously fantastic, and if we could just clone her and send her around every ward, that would be ideal. But I know that a lot of people struggle over a number of years to get their foot in the door, even. So I think places that have achieved success have first managed to secure kind of senior buy-in, whether that be from a medical director or somebody ideally at board level. And local leads shouldn't be shy in trying to get some of those meetings, but also use your PHE centre lead to try and get some of those contacts going. Because if you can get senior buy-in, then oftentimes some of these discussions on the wards can go somewhat easier. So yeah, just the importance of getting the trust committed at a high level to going smoke-free in the first instance, and then that will lead into some of those discussions.
Thanks, Martyn. We've got a couple of specific questions about CLEAR, which I think I'll ask you now. So this might have been answered in your presentation, I think. So Are there any refresher training courses planned for previously trained assessors?
That is first training priority, yes. So we will be, I'm just after this webinar, I'm just looking at the training program and the training slides. So yes, in the next couple of weeks, we will be sending something around to everybody that we've got listed, and IPIP are helping with this, who've already gone on the training or done some peer assessments, and the idea being that we'll give them a shortened refresher training session. Exactly.
Fabulous. And then also a very specific question from a couple of people: when might the deep dive for illegal tobacco be ready? And also whether there'll be any cost to, quote, purchase this.
The deep dives are all entirely free. They'll be made available online. So no, that's entirely free. The flip side of that, it has to be locally driven. There's no concept of a peer assessment around that. But the tools will be made available online. We have a draft version of it at the moment. I'm just running past that to some national colleagues that are steeped in illegal tobacco, just to make sure that it works and makes sense and it covers everything that we want it to do. I should also say, as well as primarily focusing on tackling illegal tobacco, we also have a little bit about enforcement of current legislation too, but the focus is very much on illegal tobacco. So I've avoided giving you a date, but let's say within the next month or so.
Okay, well, we'll hold you to that then, Martyn. So
Thanks,
now a less specific question, but a really interesting one. We're being asked, if you've got results from a CLEAR assessment and those results are low across the board, what advice I'm going to ask, I think all the panel probably have experience at CLEAR, what would you prioritise first if basically it all looks not great? Where would you go first? Martyn, we'll start with you.
If if it's low across the board, I think I'd be most concerned about personally about the vision and leadership element of it. So there's a lot of really practical stuff in there around what you can do around training standards, what you can do with the stop smoking service, what you can do with healthcare professionals. But I guess that all, to some degree, feeds down from the culture and the overarching ambition for the locality. So if we don't have a clearly articulated vision for where the city or the town wants to be around tobacco, if we don't have buy-in from elected members, from DPH, Health and Wellbeing Board, then I think we're going to keep hitting those obstacles practically all the way down the line. So I think that would be my first port of call, to get that senior buy-in.
I can't think of a better answer to that question, so I don't think I'll ask the others that unless they have something they burningly wish to add. We have a few specific questions for you, Alan, from your presentation. So somebody's asking where you can access the menu of preventative interventions, particularly the ones on models of stop smoking services, etc.
Okay, the menu, all the links are in the presentation. So when the presentation is sent around, they're all got hot links in them, and there are links at the bottom of each slide taking you to the particular tool.
And is there also a link in the presentation where people can sign up to get the SmokeFree NHS newsletter? I've been asked a couple of questions about how you can receive that.
Yeah, that's just being finalised at the moment. Will be for subscription only. So we do have quite a few people subscribed already to it, but that's where we've added people. But when the first letter comes out in the next couple of weeks, that will then be widely shared, and then people can then sign up through that newsletter to get the recurring one. So the first launch one will be out in the next week or so, and on that will be a link for you to then subscribe to that newsletter coming out.
So it sounds like that will be fairly widely distributed, the first one, and certainly we could share it with this group, and we can share it through the wider SmokeFree Action Coalition too, and then people can sign up to receive the newsletter in the future.
That's correct.
That sounds good. Excellent. Okay, and then we have a more difficult question. So some commentary around the challenges in engaging with the acute side of the NHS, where, locally, things like mental health and maternity might be going okay, but difficult on the broader kind of acute trust side. So there's a question that's actually directed both at ASH and PHE. So how are ASH and PHE working with NHS England, and what can we expect to see and what can we expect to see in terms of getting STPs and acute trusts to achieve the smoke-free ambition? Is there anything more you'd like to say about how PHE is working with NHS England?
PHE are starting to work a lot more closely with NHS England. There's obviously our principal way of working on this agenda has been to support the CQIN, national CQIN, and we're currently looking at CQIN obviously is in its final year, its 2 year spell, so we're now looking at the future beyond the CQIN. But we're also supporting, as we're being tasked within the Tobacco Control Delivery Plan, looking at doing a sort of snapshot audit of smoke-free status of all trusts up and down the country. So at the moment, that's something that we're talking to NHS England about how best we can do that, and how best we can report back and sort of develop a metric of how we measure smoke-free trust implementation across the country. That's something that we're increasingly now doing with NHS England, and it's a watch this space on that one. That one should come through quite rapidly over the next few months.
Thanks, Alan. And in terms of what ASH is doing, I mean, we continue to engage with NHS England at quite a senior level, and we're optimistic, particularly seeing what Simon Stevens has said to the Health Select Committee recently about the importance of embedding smoking cessation within the NHS, and his very positive response to the Royal College of Physicians report, that there is an opportunity for movement here, but obviously leadership is really important. So we will, through the SmokeFree Action Coalition Network, continue to keep you in touch with any resources that we produce, and if people have ideas, obviously let us know, but also with any progress that's made nationally on this agenda. Right, questions about e-cigarettes. Some questions about basically how we might get more localised information about e-cigarettes. So there was a question earlier on local prevalence, which if anybody's got any other thoughts on, then definitely shout. And also whether there's any data nationally on on the number of retailers locally or sellers of e-cigarette liquids, which I'm certainly not aware of in England, although Scotland has a register. So that if you were in Scotland, the answer would be yes, there's a register, and you can go and find out who they are. But also whether we have more insights and research around vaping among particular groups like pregnant women or routine and manual groups. I wonder if I might add something to it at the end, but Louise, whether you've got any thoughts on sort of more localised information or targeted information around vaping and e-cigarettes that might be useful to people.
Yeah, certainly. Leicester City did a health and wellbeing survey two years ago now, and is repeating the exercise this year, I believe, and asked a question about e-cigarette use, both in combination with smoking and to actually stop smoking. And I haven't got the figures to hand, but it is in the public domain. And it turns out that e-cigarettes were the most popular device for stopping smoking in Leicester City. And I'd be very interested to see what this year's statistics come out with. So in fact, the short answer is that if people want local information on this, they really have to talk to their public health department about including an e-cigarette question in any local health survey that they might be running. There is nothing that is mandated. It's a matter of local authorities taking an interest in that and asking the question if they're going to do a survey of the population. As far as a list of shops go, there are plans by the independent vaping sector to have a list of all the non-tobacco company affiliated vape shops, but that's not ready yet. But I think that will be a very useful resource when it does come out. And NCSCT are preparing some information about what how to establish a relationship with your local vape shop, because they can be very useful sources of information for local authorities and for stop smoking services. So that's something that will be on our website, hopefully within the next month.
Thanks, Louise. I know I've seen a draft of that and it looks very useful. Martyn or Allan, I think I'm going to go to Vicky. Vicky's got some thoughts to add to this issue of more information on e-cigarettes.
Yeah, so just a couple of resources and suggestions for where people might find research on this topic. So Cancer Research UK does a monthly digest of all e-cigarette research, so including specifics for pregnant women and for routine and manual groups. So we can circulate the link to that and people can sign up to see what's going on in the world of e-cigarette research. But also in the local toolkit, as I mentioned earlier, there is a section on the webinars we've run previously with the recordings and slides from those. And in January last year, we ran a webinar with Professor Linda Bald on use of e-cigarettes among pregnant women and the latest research and evidence around that. So hopefully that would also provide some background and context, as well as the guide for healthcare professionals I mentioned on the Smoking and Pregnancy Challenge Group website.
Thanks, Vicky. Martyn, Allan, sorry, I keep coming to you as a duo. Is there anything you'd like to say about perhaps the PHE evidence review?
Yeah, it's a good point. So yeah, we as PHE, we've been tasked by House of Parliament to undertake an annual review of electronic cigarettes, and that will last for the lifetime of this Parliament. So an annual review until 2022. The latest one came out in, I think it was January this year, wasn't it, Allan? I think that was the fourth, and that pulls together the latest evidence base. I was interested in the question that somebody asked about e-cigarette use by different socioeconomic groups, and I probably should know more about that off the top of my head, but don't. But I think it's interesting, generally, kind of new technology like this, if I can call e-cigarettes both new and technology, tends to become popular with kind of more affluent groups first of all, and not the younger groups, and then to trickle down. I think it's interesting that the latest smoking prevalence that we've seen came out last week showed there have been big declines in smoking amongst some of our youngest groups, so late teens to early 20s. I just feel that might be this trickle-down effect of people switching to e-cigarettes. That's rather speculation on my part, but that is the way we'd normally expect to see products like this starting to trickle through society.
I think we have to point to these decades of tobacco control policy as well, impacting on these young cohorts of young people coming through.
Indeed, yeah.
Not seeing point of sale display and so forth. I mean, if you're 18 now and you've had 11 years of never seeing people smoke in public places, which has got to be impacting on people's behaviours. Is there anything else you'd want to add, Allan, around e-cigarette and information that's out there for people?
Only to echo what's already been said, really, is that PHE will still continue to produce the annual reviews, but also the wealth of resources, again, not only from the NCSCT, but also our most popular Public Health England Health Matters blogs over the last couple of years, continually for the last 2 years. Every month we get an update of our most popular blogs, and it's our e-cigarette Public Health Matters blogs. So the Public Health Matters is a really good blog, is a really good platform at PHE for information. So we talked about earlier on today around tobacco control tools and resources and about how they're promoted through that platform. But there's a lot of information on e-cigarettes in there as well. And I would say that's a really good read, really good catch up. And also any big developments and advances in understanding and knowledge always gets captured in those blogs.
Thanks, Allan.
Can I add something?
Go on ahead. Yep.
I'd like to make a plea, I suppose, for trusts that are struggling with the smoke-free agenda, or know that they're going to have to move forward with this, but at the same time treating vaping the same as smoking. And we know it's not the same as smoking. PHE have been very clear about this, and ASH. And for trust managers to see that there is an advantage in being much more permissive about vaping than they are about smoking. If they're going to clamp down on anything, please clamp down on the smoking. Don't make people think by treating them the same that sorry, I'm not making myself clear perhaps. Vaping is very different from smoking, and it's not something that should be included with smoking in any site-wide ban.
Thanks, Louise. And in terms of resources that might support people around things like indoors and outdoor use of e-cigarettes, I think both Public Health England and ASH have resources designed to support organisations think through some of those issues. So I'd certainly recommend those. Just to move on a bit and think a little bit of a challenge to all of us, really, and how we present our information and how we might make it more visually engaging, a kind of plea to have things that are a bit more interactive or more infographic based. The Health Matters blogs are quite good at doing that, I think, Allan, as I recall.
Yes, we the limited graphics I've used today have come from the Health Matters blogs. There you go. So they're very good at doing generating lots of different slide sets, but it's very much in the infographic vein. It's very much about visuals, and it's very much about getting information out there that isn't just in a narrative, and something that works very good in the blogs, very well in the blogs, and it's something that dominates PHE's social media lines at times as well.
Oh, sorry, I'm on mute. Anybody got any ideas about how we might make our materials more usable and accessible to the to people, so that they can get the message out there?
Well, NCSCT has got animations, so that's always a good thing to share with people that may not be so keen on reading long scripts.
Yes, actually, and you have reminded us that we failed to put on our slides about the latest resources that we have. So in collaboration with Public Health England, we have a set of animations around smoking and pregnancy, and also some supporting infographics for those, which I think the infographics would, particularly the one around smoking in the home, would work for all different kinds of professionals. They're intended to be an aid for professionals to support them in engaging with the issues, and they are very clear and visually useful. So again, we'll make sure that we make those links available when we circulate the slides. Any other thoughts on kind of visually engaging information that Martyn or Vicky wants to add? Martyn?
I think colleagues have covered it. Just I mean, even someone who's been working for 10 years, you kind of forget what's already out there, and you kind of reminded me today about all the materials that are on the ASH website, and there certainly used to be a template presentation, had some really good stuff in it as well. NCSET, some fantastic resources. Louise mentioned the video aimed at primary care providers, GPs. Some of the videos are very moving and impactful. I've certainly used some of those at presentations before and had a room full of nurses in tears in front of me, which wasn't the desired effect. But some really good stuff. So between ASH, PHE, NCSCT, lots of good resources.
Lots out there. Yeah. Thanks, Martyn. Okay. Although I think we will take the challenge away and think a bit more about how we can make some of our information a little bit more visual. We certainly, from an ASH point of view, understand there's more we could do on that. A specific question, I think this is probably one for you, Louise. Is there VBA training for secondary care settings?
No, I'm trying to think. In fact, Public Health England has got a really good film about VBAs in secondary care, I believe. Can I throw that one back to Martyn and Allan?
Hi, it's Allan here. Yeah, I could pick that one up. We just produced some work, some video and training with Health Education England. So it can be found as part of our Sequin offer of resources. So we've got training about how to deliver VBA for smoking cessation, and also IBA for alcohol as well. So they're very good video training aimed at practitioners in hospitals, aimed at nurses, doctors and clinicians in hospitals about how to do the VBA.
I'm thinking of the one with Dr. Sanjay Agrawal, who's a great hero in smoking cessation and tobacco control circles. It's the one with him doing the talking, isn't it?
It is. So my slide set, which mentions SmokeFree NHS, there's a bullet there for Sequin. If you click on that, that takes you to a suite of Sequin resources, which will include that new training resource around VBA and stroke IBA in secondary care settings.
Thanks, everybody. I think we are reaching the end of our allotted time, and I've got one last question which I would like to ask you all to think about. So, say you were doing to close the webinar. I'd like all of our presenters to have a think about if they were launching a social media campaign in their locality. What killer fact they'd be doing, what killer fact they'd be putting out through Twitter. I'll let you all have a little think about that while I just do some housekeeping. So we have had a load more questions that we haven't had a chance to answer. So we will do some written answers to those questions to follow the webinar. We'll be circulating the presentations and the various links to things that we've talked about during the Q&A session. And if you have any more ideas, if inspiration strikes you and you think we need more of this or we need more of something else, definitely get in touch. And between our three organisations, we will certainly give it thought. So, looking for a killer fact, looking across the room at my colleague Vicky, I'm going to ask her to start. Vicky, what would you put out there as your thing that you're going to wow social media with on smoking and tobacco?
So I think I'm going to steal an idea from Hartlepool Council, which told me yesterday they, after the publication of our latest Ready Rector, put out the statistics on a targeted local basis. So for people on social media in each of their wards, they put out the stats most relevant to them. So cost of smoking to the NHS, cost of smoking to social care, and the cost of smoking-related fires were their top three. So I'm stealing that from Hartlepool, who have made good use of the reckoner there.
Thanks, Vicky. Martyn, what was your killer fact?
Am I allowed one killer fact and one killer message, please? So
yeah,
killer fact, I might be stealing Louise's here, so apologies, Louise, would be to remind partners that around about 40% of all tobacco smoked in this country at the moment is smoked by somebody with a mental health condition, and that's a disgrace in this day and age, and it kind of gives weight to what Louise says about that being one of our key priorities, to do more with that population to support them to quit. And the message would be linked to that, linked to the general population, would to remind everybody that it takes some people a number of times to quit successfully. The thing that's going to have most impact is by encouraging people to give it a go by whatever means. Ideally, we'll try and nudge them towards the most effective means of quitting, but just to give quitting a go.
Brilliant. Thanks, Martyn. Allan?
I'm going to go with a killer message as well, if that's okay. As local health commissioners and health planners, we are often faced with the challenge of identifying smokers and resorting to the fact that they can be seen as hard to reach. And I'd just like to say that our smokers are not hard to reach. They're sitting in our hospital waiting rooms and hospital beds. And while they're there, let's give them the treatment that they deserve.
Thanks, Allan. Really excellent point. Louise, you have the final word.
Okay. When you talk to people in communities where there's a lot of smoking, they tend to think that almost everybody smokes. And if you ask them what the smoking prevalence is, they'll say, it's about 80% probably. I'd like to use, the killer fact from me would be that in fact we're now in the whole of the UK hovering around the 15% mark in terms of smoking prevalence. That's correct, isn't it? 15%, the latest
Just
figures?
under, yeah, for England.
Yes, that would be it.
Thanks, Louise. And we have one from the audience. The killer fact from the audience, and totally appropriate today, is that none of the England football team smoke. So we shall close on that point. And thank you very much to the speakers and to all of those of you that have provided questions. And we'll look forward to hearing from you after the webinar too. Thanks, everybody.